Okay, share this again. All right. Okay. To diagnose schizophrenia, the following criteria must be met. Symptoms. 2 or more of the following present for a significant portion of time during a 1-month period or less if successfully treated. At least one must be 1, 2, or 3. Delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior. 5, negative symptoms, diminished emotional expression or avolition. Functional impairment, significant decline in 1 or more major areas of functioning, work, relationship, self-care since symptom onset. Do you guys remember, I just blacked out what avolition means? We talked about it last time. I think it's lack of motivation. Do y'all remember we looked it up last time? Let's see. Anyone?
Yeah, that's correct.
Okay, cool. Thanks. If y'all see something you want clarification on, please speak up. Thanks, Cheyenne. Schizophrenia, duration, continuous signs of disturbance for at least 6 months, including at least 1 month of active phase symptoms. Exclusion symptoms are not attributable to substance abuse, medical conditions, or other psychiatric disorders. This is really important. You guys pay attention. So positive and negative symptoms of schizophrenia. So the way that my sister, she's a psych nurse, and she's like, oh, this is how I remember it. Positive is something that it adds to your personality. I like to think of it like adds to your reality, right? Negative is something that it takes away from your personality and your reality. I don't know if that helps anyone, but positive symptoms. So excess or distortion of normal functions. Again, we're adding stuff to our reality, our personality. Hallucinations, we're adding something. Sensory experiences without external stimuli. Delusions, strong false beliefs not based in reality. Disorganized speech, incoherent or logical communication. Disorganized or catatonic behavior, unpredictable or bizarre behavior, or lack of movement responses. Okay, negative. So again, this is taking away. Affective flattening, so diminished emotional expressions. It's taking away our emotions and our ability to like show our facial features, emotions through our facial expressions. Alogia, I'm not sure if I'm saying that right. Limited speech output or content. Avolition, lack of motivation or goal-directed activity. Ahedonia, reduced ability to experience pleasure. Social withdrawal, isolation from others. So again, positive and negative, that's important. Okay, can somebody read bipolar 1 disorder?
Hey, Tessa.
Yeah.
Just really quick, something that I just thought of with the positive and negative. It's
Okay.
kind of like reinforcement, right? For positive, you're adding something, and for negative, it's not necessarily, but you want something to be, you're not necessarily taking away, but
Okay.
that's kind of how I thought about it, is like kind of liken it to reinforcement. It's kind of similar to that.
Yeah, for sure. Thank you. That's a different way of looking at it for sure. So guys, just as a reminder, you guys, I always say this, please speak up, because hearing like me and Bridget's different ways of looking at it and remembering it, that's going to give you your own unique way of remembering it. That's the most valuable thing about these Zoom sessions is discussion. Okay. Can someone read this part for me?
I'll read. Bipolar 1 versus bipolar 2. Bipolar 1, the key features, at least one manic episode lasting at least 1 week, marked by inflated self-esteem or grandiosity, decreased need for sleep, increased talkativeness, racing thoughts or distractibility, impulsive high-risk behaviors, and then manic episodes may or may not be followed by major depressive episodes, and severity more severe due to the impact of mania, like hospitalization often required.
Yes, ma'am. Thank you. Guys, I really don't think the test is going to be that specific. I think what I'm trying to get at with these slides is that the bipolar 1 is characterized by the manic, the more mania, right? And the bipolar 2 is going to be the depression. If anyone has any fancy ways to remember 1 and 2 or a different way of putting it that I'm saying, put it in the chat or feel free to use your voice. All right, can somebody read bipolar 2?
I can read. Bipolar 2 disorder. Key features at least one hypomanic episode and one major depressive episode. Hypomania, similar to mania but less severe, lasting at least 4 days, not impairing daily functioning. Episodes. No history of manic episodes, only hypomania and depression. Severity. Typically less severe but chronic due to depressive episodes. Key difference. Mania, bipolar 1, is more severe and can cause functional impairment, while hypomania, bipolar 2, is less extreme and does not disrupt daily life.
Perfect. All right. Moving along, guys. 1 is high, 2 is low, right? Couple things before we start, and I'm sure the slide's gonna say it. The main thing that you need to know, you guys, when answering anorexia and bulimia is anorexia. If there's a keyword in the question talking about low body weight, that's the main difference, right? Anorexia is, they're gonna have low body weight. Bulimia, not quite as much. I mean, they might, I guess, but anorexia is characterized by the low body weight. And the test is not gonna try to confuse you with that, you guys. If it's talking about low body weight in the question, it's going to be talking about anorexia. Can someone read this one for me?
I can read it. Anorexia versus bulimia. So anorexia, the key feature is persistent restriction of energy intake leading to significantly low body weight. The subtypes are restricting type, which is no episode of binge eating or purging, and then also binge eating purging type, which is occasional binge eating or purging. The core symptoms are intense fear of gaining weight or becoming fat, and distorted body image or denial of the seriousness of low body weight. And I actually just wanted to kind of touch a little bit more on that. I just recently had like a quiz question that asked which one is more common, and I had picked anorexia, but it's actually binge eating. Just wanted to throw that out there.
Yeah, that's actually something, a population that I specifically treat at private practice is binge eating. It's like, and it's like, you can't tell, they look like normal body weight, right?
I have a quick question. So binge eating does not necessarily include purging at the same time, right? It can just be simply binge eating without purging.
In fact, it's more often than not just the binge eating. The
Okay.
purging is like very, I would say like, this is again, my opinion from what I've seen, is like, I feel like 75% of people that binge eat don't purge.
That's what I thought. Thank you.
Yeah, for sure.
Is
Just another way.
then with binge eating also the body weight higher?
Not necessarily at all. You would think, but not necessarily.
Okay.
And remember, guys, all these, going off on another tangent, but all these are like symptoms of how we deal with trauma, stuffed emotions, painful emotions, situations that are out of our control. Like this is just a symptom of that, right? A way that we cope. Okay, can somebody read bulimia?
I'll read. Bulimia and anorexia. The key features: recurrent episodes of binge eating followed by compensatory behaviors to prevent weight gain. Compensatory behaviors that include self-induced vomiting, misuse of laxative, diuretics, fasting, or excessive exercise. The diagnostic distinction: individuals with bulimia are typically at a normal weight or above. Episodes of binging and compensatory behaviors occur at least once a week for 3 months. Tessa, I just got one question before you go into this one. Like, with the difference in the anorexia and the bulimia, like, you know, do you remember if there was like questions on the test where if it was like, was this a mild episode, was this a moderate, and what made it be mild or moderate or no?
I don't remember any of that, but again,
Okay.
remember there's like 8 versions. I personally don't
Okay.
remember any of that.
Okay.
Good question though, because you could go down a whole rabbit hole with that medium, moderate, and right, severe. Do I think you guys actually, now that I'm thinking about it, I'm having a flashback of studying. I do think you should be familiar with that. Maybe I'll put that in the part 3 of the presentation. The acute, chronic, what's the other one you guys that I'm forgetting right now?
Mild, moderate, severe, and
Yeah.
extreme.
We'll go over that. I'll make, thank you for the idea, because I'll go over that maybe next time. I'll look up the DSM like definitions of that, because I think it's gonna help you and give you like a solid foundation of how to answer those questions if you understand that, if that makes sense, you guys. If anyone knows, feel free to put it in the chat. There's so many people on here. I'm sure someone has a job that's focused a lot on the DSM that could help. Yeah. I'm not sure what you mean, Joel, but if you, okay.
Oh,
Um,
just I'm a trauma specific therapist, but um, uh, just this last month, I've been working with someone who's, after 7 years of binging and purging,
no.
went from daily for 17 years to 0
No.
after they saw a holistic medical, integrative medication provider who gave them essentially a dopamine stimulating medicine, and their ADD and their aggression went down from like 10 to 2, and they stopped drinking, which they were drinking 60 beers a week, and they stopped binging and purging for,
What a beautiful story. Yeah.
yeah, like 100 to 0. So it's this mixture of trauma and biology that I see over and over.
Yeah, that's awesome.
That doesn't help us with the DSM because
right.
this
No,
test.
it's a great story to keep us engaged, though.
Sorry about that.
No, you're
This
fine.
test is archaic. Anyways, I'll shut my mouth.
No, you're fine. We love anyone that stands up and speaks and kind of makes the Zooms like more or less so dry, right? I find with the people that I treat with the eating types of like behaviors, it's not always, but some sort of trauma that they're not dealing with way underneath everything, right? All right, can somebody read GAD, or generalized anxiety disorder?
I can. Okay, go
Go
ahead.
ahead, Jennifer.
Generalized anxiety disorder definitions: excessive anxiety and worry about various activities or events, occurring more days than not, at least 6 months. Key symptoms: 3+ required in adults and 1 or more in children. Restlessness or feeling on edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, sleep disturbance, difficulty falling or staying asleep, or restless sleep. The impact, the anxiety or worry causes significant distress or impairment in social, occupational, or other areas of functioning. The exclusions symptoms are not attributable to substance use, medical conditions, or other mental disorders.
Thanks, thank you. Anyone have any thoughts or anything on GAD? Speak up. I think my supervisor always tells me the most important thing to remember that is about the excessive worrying. If they're sitting in front of you like in an intake and they're talking about excessive worry, your mind should be asking them about these other symptoms too. This is how we feel about the test. I have a feeling some of you on here. All right, can somebody read major depressive disorder?
Okay, so major depressive disorder. Definition: persistent depressed mood or loss of interest, pleasure in most activities for at least 2 weeks. Key symptoms: 5+ required, including at least 1 of the first 2. Depressed mood most of the day, nearly every day. Markedly diminished interest or pleasure in activities. Significant weight change or appetite disturbance. Insomnia or hypersomnia. Psychomotor agitation or retardation, fatigue or loss of energy, feelings of worthlessness or excessive guilt, difficulty concentrating or indecisiveness, recurrent thoughts or death or suicide, impact or symptoms cause significant distress or impairment in social, occupational, or other areas of functioning. Exclusions, not attributable to substance use, medical conditions, or another mental disorder, example, bipolar disorder.
Cool. Thank you. All right, somebody had requested that I do this one again, so, somebody had asked about schizoid, so make sure whoever's, if you're on here. I feel like schizoid has been known to show up on the test. I've seen people talk about it anyways, so if someone wants to read that one.
I'll read.
Okay, go ahead.
Schizo personality disorder. I'm sorry, hold on, I was getting the call. A pattern of detachment from social relationships, and restricted emotionally expression beginning in the early adulthood. Some key symptoms, 4 required, 4+ required, prefers solitude and lacks close relationships, little interest in sexual or intimate relationships, takes pleasure in few, if any, activities, appears indifferent to praise or criticism, emotional coldness, detachment, or flattened affect. Impact significant impairment in social or occupational functioning. Exclusions not due to schizophrenia, another psychotic disorder, or autism spectrum disorder.
Cool, thank you. What's your name?
Tess, I'm Tiffany.
Oh, I thought that was you. Hey girl, you're back with us.
Hey.
Welcome back. You lost us for a while. I thought that was you just because it said Zoom on your thing.
Yeah,
We're glad
sorry.
you're
Yeah.
back.
Yeah, I'm glad to be.
The group is much bigger now, right?
Yes.
Yeah. Okay, guys, I got a little question. If you guys were taking the test and this showed up on your test, what keywords in the question would you know that it's schizoid? What do you guys think? Like and then obviously one of the answers is schizoid, but what do you think some of like the keywords are that like make it stand out, right? Y'all can put it in the chat or say it out loud. Yeah, I like the solitude too. I think for me, what stands out is the little interest in relationships. What else, guys? Social relationship detachment, yeah. Again, the test, guys, it's not going to pick like the most rarest thing about schizoid and put it on there. It's going to see if you generally know what characterizes schizoid, right? Yeah, anything else? Any other thoughts, you guys? Maybe the flattened affect too. Yeah. Is that on there? I don't really know about paranoia. I don't know if that's a main thing of it. Maybe, I could be wrong. All right, cool, guys. Let's see what else. Okay, can somebody read about agoraphobia?
I'll read it.
Thank you.
Okay, agoraphobia, intense fear or anxiety about being in situations where escape might be difficult or help unavailable during a panic-like episode. Key situations, 2+ required. Using public transportation, being in open spaces like parking lots, bridges, being in enclosed spaces, theaters, shops, standing in line or being in a crowd, being outside the home alone. Behavioral response, these situations are avoided, endured with intense fear, or require a companion. Duration, symptoms persist for 6 months or more and cause significant distress or impairment. Exclusions, fear is not, is not better explained by another mental disorder. Examples, social anxiety disorder or a specific phobia.
What do you guys think about this one now? What do you think the keywords would be for agoraphobia? Like the main things that you think the test would ask, if it was just asking if your general knowledge, if you know what it is, what do y'all think a couple keywords would be?
Intense fear.
Yeah, attached to the open spaces, right? Those are people that like don't leave their house.
What about the duration?
Oh, I was just gonna say that.
What do you mean?
Like, I think that that could possibly be something that could be worded in a question. You know, it's just so many diagnoses and like that duration and stuff. Sometimes that, you know, it could be the same as almost similar as another diagnosis, but it's just like those little words that just separates it from being something that it's not. So
Yeah, for sure.
The 6 months or more seems to be kind of a longer duration than other types of diagnoses to me.
For sure. What other one was 6 months, you guys? Do you remember? A couple slides ago?
Generalized anxiety disorder.
Yeah, and I have no idea how I memorized that when I was studying. I just remember the anxiety, that GAD is 6 months, and I think what the depression is 2 weeks.
2 weeks. Yes.
Yeah, I don't know how I remember that. Just repetition, honestly, going over these things like a million times until it's stuck. Okay, cool.
I think a keyword would be here also like where escape is difficult.
Yeah, correct. Like their fear of being in a place where they're not gonna be able to get out of. So that fear like controls their life really, and they stay home. People, I think we've all seen movies, right, where someone has agoraphobia. That's where I know it from. Can't think of the name of it right now, but I can think of the movie. Okay, let me stop sharing and pull up the other one. All right, so I took what y'all said at the Zoom the other day and just made some more that y'all wanted to go over. Just find it here. Okie dokie. Let's see. Okie dokie, artichoke. All right. Okay. Part 2. Can somebody read about schizoaffective disorder?
I can read.
Thank you.
Schizoaffective disorder, a mental health condition characterized by a combination of symptoms of schizophrenia, delusions and hallucinations, and mood disorder symptoms, depression or mania. Key features include psychotic symptoms, present for at least 2 weeks without mood symptoms. Mood symptoms, depressive or manic episodes that occur alongside psychotic symptoms. Distinction, both psychotic and mood symptoms must occur, but are not exclusively tied together.
Thank you. I think what stands out to me in schizoaffective, and I think what would, if there was a question on this, I just believe that you need to know, you guys, psychotic and mood symptoms together is going to be schizoaffective. So in the question, is it talking about mood and psychotic symptoms, or is it just talking about psychotic symptoms and just talking about mood symptoms? Because, right, mood symptoms is going to be our GAD, our depression, our bipolar 1 and 2. Psychotic is going to be other schizophrenia, things like that. So I just don't feel intuitively like it's going to ask like, it's going to want you to recognize that mood and psychotic together is schizoaffective. If you have any other thoughts on that, let me know. Okay, can somebody, this one seems to be one that I've heard people say is on the test a lot, and that we see probably, I see it in the clients that I see all the time. Can somebody read borderline personality disorder?
I can read.
Cool.
Okay, so it's a mental health condition marked by instability in relationships, self-image, and emotions with impulsive behavior. The key features are fear of abandonment, intense, unstable relationships, so idealization and devaluation, unstable self-identity, emotional dysregulation, impulsivity, suspending, substance use, self-harm, chronic feelings of emptiness, intense anger or difficulty controlling anger, transient stress-related paranoia or dissociation, So the key terms are emotional dysregulation, impulsivity, fear of abandonment, splitting, and self-harm.
What else do you guys know, like before reading this slide, maybe, what else do you guys know about borderline personality disorder? Like how would you know something's talking about borderline personality disorder?
The one
Or
thing
is-
that I think of, not necessarily diagnostically, but DBT is used a lot for borderline personality disorder.
100%. At first, I think it like first started out for DBT for people that were suicidal, if I'm not mistaken, and then they found how well it worked in BPD. I could be wrong on that, but I remember hearing that somewhere or something like that. I think another thing that's standing out that's a term that everybody needs to know, splitting. Can somebody tell me what splitting is?
Yeah, I could be totally wrong, but is it where something is either all good or all bad?
That's exactly what it is. Or all black, all white, no gray area. It's I love you or I hate you.
I hate
right?
you, yeah.
Yeah, so you see that like when couples come in for counseling and one of them has BPD, they will just like in a second flip to I freaking hate you from like the moment before they were just talking about how much it's just one little thing will make them flip. So I think that it's a good term that could show up on the NCE, maybe just not necessarily with BPD it could, but I think that's an important term to know. Fear of abandonment. Go ahead. Somebody was saying something. No. All right. Also instability in relationships. That's another big key thing about BPD. Emotional dysregulation, instability in relationships, guys. And like all or nothing, black and white thinking, no middle ground is the splitting. All right. Can someone read oppositional defiant disorder?
I can read. Oppositional defiant disorder, a childhood behavioral disorder characterized by a pattern of angry, defiant, and vindictive behavior. Key features: angry, irritable mood, frequent loss of temper, touchiness, or resentment, defiant, argumentative behavior, refusal to comply with rules, arguing with authority figures, or deliberately annoying others. Vindictiveness, spiteful or revengeful, revenge-seeking behavior at least twice within 6 months. Key terms: defiance, anger, irritability, argumentativeness, and vindictiveness.
Yeah, one thing I didn't put on the slides, it's like coming to my awareness right now, is the ages, because the next one we're going to talk about is conduct disorder. Someone please correct me if I'm wrong, but from my memory, oppositional defiant, I want to say is like 3 to 12, and usually conduct is like 12 to like 18 or something. I believe, I don't know how important that is, but oppositional defiant like can turn into conduct disorder.
Right.
Yeah.
Yes, but conduct disorder has to be, the client has to have be diagnosed with oppositional defiant but on or before age 15, before you can diagnose them with conduct disorder.
Thank you. Yeah, I knew it was something like that. So ODD comes first, basically. Also, I want to like the memory device that helped me. I don't know where I heard it at. I've heard it several times now. When we're talking about ODD and conduct, I remember I put it in yellow up here. Remember that C is for criminal. So conduct disorder is generally, I think, I don't know, generally or always going to include like some sort of criminal behavior. Cool. So I'll read this one, you guys. So conduct disorder is a behavioral disorder in children and adolescents marked by persistent pattern of violating societal norms, rules, or the rights of others. Aggression towards people or animals, bullying, physical fights and cruelty, destruction of property, deliberate vandalism or arson, that's that criminal aspect, deceitfulness or theft, lying, stealing, or breaking trust, serious rule violations, truancy, running away, or breaking curfews before age 13. That's going to be aggression, key terms, aggression, property destruction, deceit, theft, rule violations. So remember, if the question is asking something along the lines of misconduct, or oppositional defiant, you're gonna look for the keywords in the question that make it like the criminal acts, right? The lying, I'm sorry, no, the lying. The vandalism, the arson, the theft, burglary, robbery, whatever. Anyone else have any, like, that deals with these, with kids every day, that wants to give any insight? No.
No, I think you said it all. I don't know if you said like set fire.
Yeah.
Yeah. So you said it
Yeah.
all. Mhm.
Yeah, so just key thing is that criminal part, guys. C. All right, somebody else is saying. Yeah, lack of remorse for sure, Angie. Thanks for pointing that out. Yeah. Okay. Okay, attention deficit hyperactivity disorder. Can somebody read that?
A neurodevelopmental disorder characterized by inattention, hyperactivity, and impulsivity that interferes with functioning or development. The key features are inattention, difficulty sustaining focus, careless mistakes, forgetfulness, disorganization, losing items, hyperactivity and impulsivity, fidgeting, inability to stay seated, excessive talking, interrupting others, difficulty waiting turn. DSM-5 criteria. Symptoms must be present before age 12. Symptoms must occur in 2 or more settings, home, school, or work. Symptoms must interfere with functioning and not be better explained by another condition. At least 6 symptoms of inattention and or hyperactivity, impulsivity for children, 5 symptoms for adults. And then key terms are inattention, hyperactivity, impulsivity, early onset, multi-setting, impact.
Thank you. Anyone have anything else, about ADHD? That we missed? Someone had told me a while ago, or I saw somewhere, at this point I can't remember, where someone said they asked the difference between ADD and ADHD on the test. It was like months ago that I saw someone say that, so I wanted to include ADD as well. And correct me if I'm wrong, guys, but the main thing that I see is just the hyperactivity is not a part of the ADD. So I wanted to include it, but it's actually, it says a term previously used to describe what is now classified as ADHD. Someone also brought it to my attention the other day that it's not in the DSM anymore. I'm not positive about that. If anyone wants to provide insight or knows about that.
That's what I thought too, that it wasn't.
Maybe it was you that was talking to me about it, but somebody put it in my head that they wanted it on the slide, so I was like, here we are. But I don't know that it would mention it on the test if it's not in the DSM anymore, right? Maybe, who knows? So ADD is a term previously used to describe what is now classified under ADHD, predominantly inattentive presentation. It focuses on inattention without significant hyperactivity or impulsivity. So the key features are inattention, difficulty focusing, frequent careless mistakes, disorganization, forgetfulness, avoiding sustained mental effort, losing items, absence of hyperactivity, little to no excessive physical activity or impulsiveness. So that's going to be the difference right there. ADD is not a separate diagnosis. It is classified as ADHD, predominantly inattentive presentation. Symptoms must impact functioning and meet ADHD criteria regarding onset before age 12 and presence in 2 or more settings. So key terms is inattention, distractibility, disorganization. Somebody's saying something. No, F9 codes, no ADD. Okay, cool. Yeah, thanks. Predominantly inattentive. Okay, so we'll move on from that one. Okay, guys, this is really important. Listen up. It's really important that you understand before the next slide what the difference is between egosyntonic and egodystonic. Let's see, I'm gonna read it, and then if y'all could chime in, please put it in your own words, because it's, for me, I had to hear it put several different ways before it like clicked. These are really important terms though. They could show up in they could just ask you the definition of these terms, or they could integrate it into a question, and then the answer is gonna determine, like, if you know the definition of that is gonna be the deciding factor on the answer, right? So egosyntonic your thoughts, behaviors, or feelings that are consistent with the person's self-perceptions, values, or goals. The individual does not see them as problematic. Traits in obsessive compulsive personality disorder are seen as a part of their personality and acceptable. Ego dystonic are thoughts, behaviors, or feelings that are inconsistent with the person's self-perception, values, or goals. The individual finds them distressing or intrusive. Obsessions and compulsions in OCD are seen as unwanted and distressing. The key difference, ego syntonic aligns with the person's sense of self, while ego dystonic conflicts with it and often causes discomfort or distress. Can you guys give me feedback on that? What do y'all think? How did you remember it before I read the slide?
So what I think of with ego syntonic is I'm in sync. The SYN point part of it is like I'm in sync with my own values and perceptions, right? So everything inside of me is in sync with my behaviors. That's what I think of with ego syntonic.
Yeah, perfect. Anyone else have any thoughts or anything? I mean, I feel like I can't explain it well, like I understand it, but so like, see if this comes out right. Obsessive compulsive personality disorder would be ego syntonic. So I don't see a problem with my behavior, right? Like I'm a perfectionist. I get things done. I get straight A's. I show up on time everywhere and I don't see a problem with that. But like it's to an extreme. Like I have to be exactly 7 minutes early wherever I go or I flip my crap, right? But I don't see a problem with it. So I feel like it'd be, in my opinion, guys, going off on a tangent, I feel like it would be actually harder to treat and counsel and therapeutically help someone if they don't see a problem with their personality and their behaviors. Does that make sense? They see it perfectly fine.
One example that I've heard is like a car thief, right? They're out stealing cars because they're really, really good at it and they don't see a problem with it because they're so good at it. Yeah, I steal cars. I'm really good at it. What's wrong with that?
Exactly. That's a perfect example. Thank you. Ego dystonic would be thoughts, behaviors, or feelings, right? That's inconsistent with your self-perception, values, or goals. Can someone give me an example of that? I'm trying to think what would be, I want to say, but I don't know if this is actually right. What do you guys think of like, do narcissistic people, are they ego or syntonic? Like they don't see a problem with their behaviors?
I
I
would
don't know.
think so, yeah.
Yeah, but dystonic, okay, so like a person with obsessive,
Item number 20,
make sure y'all mute your phones.
$29.
Quinn, make sure you mute your phone. The person with obsessive compulsive disorder may experience intrusive thoughts about harming a loved one, right? These thoughts are ego dystonic because they go against their core values of caring and protecting loved ones. That's ego dystonic, goes against their values. The individual feels significant distress and discomfort because the thoughts are inconsistent with how they view themselves. Is everybody good on these two terms? I really feel in my gut, y'all are gonna need to know these.
I have a question.
Okay.
We may have just asked and answered this already, but on the ego syntonic, where with ego dystonic, it's distressing and they do see an issue. Whereas the ego syntonic, they don't there's nothing they don't have those that distress or discomfort with their behaviors or their thoughts. There's
What do you
no
guys-
feeling of discomfort by what they do or what they think.
Yes, Joel actually I just put like a really accurate little statement that I like that will help you is syntonic fills you up, dystonic stresses you out.
Okay, yeah.
Yeah. So I'm trying to like wrap my head around you guys like what like someone with OCPD, like why would they come to therapy? Why do you guys think they would come to therapy if they don't see that they have a problem? What What do you guys think? What would be like your first thought of why that person would
I
be
would think that everyone else in their mind, everyone else has a problem with them in the way that they behave.
Yeah,
And so maybe maybe they would question whether there is an issue, or maybe they would question why everybody else has an issue with them and
yeah,
their
and
behaviors.
I love that. Yeah, that's actually the first thing that comes to my mind is like your partner is like, look, your behavior is driving me freaking crazy, and unless you get help, I'm gonna divorce you, right? Or Angie also said being court ordered, that could be something like they're in trouble with the law or something.
And I was kind of thinking like in the workplace, if you're causing a lot of problems at work and your boss is like, you got to go figure this out, whether you believe it or not, you have to keep like your job.
For sure. Yep, yep. Good
I-
examples.
I better not get this one wrong on the test, because I guess I was like sitting here as everybody was sharing and stuff, examples. I was like, because I work in a prison. And so the incarcerated population, of course, a lot of the times they don't think that they should be in prison for, the criminal behaviors or criminal acts that they've done. And sometimes it does, like I'm telling you, you could be sitting there having a conversation with an individual and you definitely don't think that that person is capable of a lot of the things that the documentation says. But I mean, wow. So that's how I'm going to relate it. I hope I get that right on the test.
No, that's good. Yeah. All it takes is discussing this stuff, guys, like we are today, to get it to like stick and sit, right? I'm sure it's really helpful. Thank you for everyone's input. Okay, so I wanted to do that before we went into obsessive compulsive disorder, so it helps you guys better understand. Can somebody read this one for me? OCD.
I'll read it. OCD, a mental health condition characterized by intrusive, unwanted thoughts, obsessions, and repetitive behaviors or mental acts, compulsions, performed to reduce distress caused by the obsessions. Some key features are obsessions, persistent, intrusive thoughts, urges, or images causing anxiety. Some examples are fear of contamination, doubts, or unwanted taboo thoughts. Compulsions, repetitive behaviors, hand washing, checking, counting, or mental acts. Examples, praying, repeating phrases aimed at reducing anxiety or preventing a feared outcome. Time consuming. Symptoms take up significant time, more than an hour per day, and impair functioning. Key terms, obsessions, compulsions, intrusive thoughts, anxiety, and repetitive behavior.
Perfect. Yes, thank you. Another thing that's coming to my mind to tell you guys right now. Make sure you know the difference between obsessions and compulsions. Obsessions are what, you guys?
Thoughts,
Yeah. Compulsions are?
behavior.
Cool. You guys know my weird way of remembering stuff is always with letters. So B and C, like compulsions is behaviors, B and C go together. I don't know. I have a weird way of like memory devices in my head, and mine's always like letters. If anyone has any other hints or ways they remember that, I do feel like that is important to understand. All right. Okay, also, remember the difference. This one's gonna be egosyntonic. It's a personality disorder. So can somebody read this one? Obsession is thoughts, compulsion is behavior. Shady. Sorry, I kind of went fast on that slide, but yes, obsession, thoughts, compulsion, behavior. You're welcome. Can somebody read this one?
I can. Obsessive compulsive personality disorder. OCPD, a personality disorder characterized by preoccupation with orderliness, perfectionism, and control, often at the expense of flexibility and efficiency. Key features: perfectionism, excessive focus on details, rules, or organization, leading to inefficiency. Control, rigid standards for self and others, difficulty delegating tasks. work over leisure, prioritizing work or productivity over relationships and relaxation, inflexibility, stubbornness, difficulty, discarding items or strict adherence to morals and ethics. Key distinction from OCD. OCPD is a personality style focused on control and perfectionism, often egocentric, viewed as acceptable by the person, whereas OCD involves intrusive thoughts and compulsive behaviors, which are ego dystonic, causing distress. Key terms: perfectionism, rigidity, control, orderliness, work focus.
Cool. All right. Are we good on those guys? If not, please speak up. All right. Okay, I got a quiz for us, you guys. Give me a second to find it. Okay. So when I made the quiz, you guys, I try my best, but again, I'm not a professional. So if you've seen mistakes, let me know before I post it. Also, a couple things. The quiz isn't necessarily just about what I put on the slides. I just like copied and pasted DSM information and like plugged it into AI and then asked it to generate questions. And then I went through and like edited it. So this is like, it could include stuff that I haven't even put on the slides yet. So don't be hard on yourself if this is your first time like reviewing DSM stuff since you've been in school, or, you know, no big deal. Have some self-compassion. We try our best and we work together and work out the answers together. Let's see, let me see. I also try to make it to cater to all different levels of studying, but that's kind of hard, obviously, because everyone's at different places. But I try my best. Okay, 1 moment. All right, guys. Here we go. I'm going to read it out loud. Yes, you guys, I'm going to post the recording. We're at the end of, when I'm done, remind me, I'm going to show you guys where the recordings go. Okay. You guys can say the answers out loud or put them in the chat. I'm going to read through the whole question so we get used to reading through the whole question, because I don't want us to get in the habit, especially on the test, of like reading the question quickly and answering quickly. We need to be in the habit of reading it slow and reading it all the way through, and sometimes reading it twice. Don't get yourself in bad habits, because you'll read it fast, pick an answer fast, and then if you would have read it thoroughly, oh wow, A and B, it really was, it was B. Like I didn't read that tiny difference because I was rushing. Very important. Don't let our anxiety get the best of us and rush through things. Literally, like, I don't know, hit yourself on the forehead and be like, slow down and read it slow. Okay, so 1, which of the following is a hallmark feature of major depressive disorder, MDD? And again, actually, guys, let me just interrupt. I believe these questions are probably a little bit harder than they are on the test, to be honest. Gets our brain working. A, recurrent panic attacks. B, depressed mood or loss of interest, pleasure in nearly all activities. C, persistent worry about multiple issues. D, mood swings between mania and depression. What do y'all think?
Yes, I'm boy.
Yes. Okay, I see mainly B's. I do see someone that said C and someone that said D. So let's look, let's not overthink it, guys. So we're just talking about major depressive disorder. Okay. A can obviously have nothing to do with major depressive disorder. C is going to be GAD. That's what we're talking about. The key word with GAD and generalized anxiety disorder is that worry. That's not going to be, I mean, maybe it's major depressive, but that's going to be a key word in GAD. Okay. Generalized anxiety disorder. Also, D, mood swings between mania and depression. That's going to be bipolar. Probably bipolar 1, honestly. You're welcome. So the answer is B. Most of us said B. There was a couple out there who didn't, though. So make sure you're reading it all the way through and not overthinking it or adding stuff like that. Just major depressive disorder. Okay, cool. Moving along. What is a key characteristic of panic disorder? A, excessive worry about multiple life domains. B, fear of specific objects or situations. C, reoccurrent unexpected panic attacks. Or D, avoidance of social situations.
See?
Yeah, it is C. Good job, everybody. So I think D, when I'm reading the question, D would probably be social anxiety disorder. B is probably going to be phobia, something with phobias. And then A is probably going to be GAD, right? Okay, good job, you guys. 3. Which, oops. Let's see. 3. Which disorder is characterized by difficulty initiating or maintaining sleep, occurring at least 3 nights per week for 3 months? A, insomnia disorder. B, circadian rhythm sleep-wake disorder. C, I can't even say that, hypersomnolence disorder. Or D, narcolepsy. Don't overthink it, guys.
A.
Yes. The answer is A. But I want to look something up really quick. Does anyone know what C is?
Sleeping too much?
Is it?
Yeah, isn't that when they just kind of can fall asleep at, like, no, that's narcolepsy. I'm
Yeah,
thinking
narcolepsy is where like I'm talking to you guys right now and I just like nod
fall
off.
asleep. Yeah, okay.
Yeah, that one is
Excessive sleepiness.
excessive sleepiness.
Okay, so I'm gonna read the actual definition on Google. It says, I can't pronounce it, right? But here we are. Is described in the DSM-5 as a sleep-wake disorder characterized by excessive daytime sleepiness, despite a main sleep period lasting at least 7 hours. So their sleep is normal, but they're still excessively tired during the day. It goes beyond feeling just tired and significantly impacts daily functioning and quality of life. That's interesting. Okay, number 4. Which symptom is not typically associated with obsessive compulsive disorder? A, intrusive unwanted thoughts. B, excessive worries about real life problems. C, repetitive behaviors performed to reduce anxiety. D, fear of contamination. This is, remember, we're thinking just about obsessive compulsive disorder, you guys. One of them doesn't fit. What do you guys think? Everybody's saying D. Actually, no, guys, D is something that goes with OCD. The answer is, I think it's B, but let me double check.
American Express,
Yeah, it actually is
Capital
B, guys.
One, and City.
So, you guys, I don't. Okay, can somebody help me understand? All of you guys who are answering C, why did you guys say C? Because that would be something that is associated with OCD. Can y'all tell me why you thought C? Anyone? Maybe y'all didn't see the not. So remember, repetitive behaviors, that's what OCD is, performed to reduce anxiety. The answer is B, yes. B is gonna be, that's gonna be more like generalized anxiety disorder. OCD is not characterized by excessive worries. Maybe it's part of it, but it's not characterized by it for sure, right? The anxiety threw you off, yeah, for sure. Yeah, Jocelyn, I had a feeling that, because I know you've been studying for a while, I had a feeling you guys missed the word not. Right, Joel. Yeah, good job, you guys. Kind of, anyways. We're gonna do better now. 5. Which diagnosis is most likely for a client with at least 6 months? Remember, we talked about this, of excessive worry about various life events, along with restlessness and muscle tension. You guys got this. We just talked about this. What do y'all think? A, adjustment.
DSM boy. I'm
Nice.
sorry.
You can say it out loud. A, adjustment disorder. B, generalized anxiety disorder. C, social anxiety disorder. Or D, specific phobia. My chat thing keeps messing up, you guys. I don't know why. One moment. It's like huge covering up my thing. Okay, there we go. Yes, it is B. So remember, guys, when we're answering questions like this, don't add stuff to the question, right? Like it doesn't say anything about social situations to make us think that it's social anxiety disorder. Specific phobia, it says nothing about like a fear of a specific object. An adjustment disorder is like an umbrella when you don't know how to diagnose someone, right? They're just going through something, but we don't know what it is yet. This is very specific. 6 months, excessive worry, restlessness, muscle tension. So adjustment is more, that's not going to be an adjustment disorder. It's too specific. So yes, it is B. All right, 6. A client exhibits reoccurring episodes of overeating followed by purging. Which diagnosis is most appropriate? 6. A, anorexia nervosa. B, bulimia nervosa. C, binge eating disorder. D, avoidant restrictive food intake disorder. What do y'all think? Okay, everybody's saying B. Yes, it is B. So remember, anorexia can include purging too, you guys, but we were looking for that keyword of low body weight or obsession with low body weight and having low body weight, and that's just not present. So bulimia. Okay, we got 9 more, you guys.
Yes, sir. Can you explain that again, please?
Yes, so a client exhibits recurrent episodes of overeating followed by purging. So it's not saying anything else other than the person overeats and purges. Binge eating is not characterized by purging necessarily. It may include it, but it's not characterized by purging. That's not one of the main things. It's just like obsessively overeating, right? Bulimia is binging and purging, right? Or purging, really. Anorexia could be purging, but the difference would be if it says in the question a low body weight.
Okay, got it. I keep getting that wrong, so.
Yeah, it's
Thanks.
confusing for sure. Especially when there's like overlapping symptoms, you just have to look for those keywords, and also don't overthink the question and add words that aren't in the question, right? 7. What is a key criterion for diagnosing oppositional defiant disorder? A, persistent defiance of authority figures lasting at least 6 months. B, physical aggression towards others. C, repeated violations of societal norms. D, frequent temper tantrums only in public settings. What do y'all think? Everyone is saying A. Yes, it is A, you guys. So remember, the societal norms one is going to be the criminal, I believe, if I'm not mistaken, the conduct disorder one.
Yes.
All right. Okay, 8. A child with autism spectrum disorder may exhibit which of the following symptoms? A, avoidance of specific objects or situations. B, deficits in deficits in social communication and repetitive behaviors. C, frequent lying and rule breaking. D, attention deficits and hyperactivity. Everybody is saying B, yes. If anyone does not know why that's the answer, please speak up. That's a big thing about autism is the social communication, like socially how they act, right? So does anyone specifically know a lot about autism? Or anyone work with people that have autism?
I do. I have as a registered behavior technician.
Can you tell us, because Eugenia is asking why, B is the answer. Can you tell us a little bit about people that have autism and stuff, like some of their symptoms and stuff?
Yeah, some other symptoms might be not having direct eye contact with the person. Also not understanding what the person is saying, and a number of other symptoms, like for example, it could be that they might not get what you're saying at that moment, so you have to repeat it to them so they can understand it even better. And sorry for the background noise.
You're good.
And also like they have repetitive behaviors, which it can be like stereotypical and nonverbal behaviors.
Yes.
I would also like to add, because I just did a diagnostic assessment on someone that has autism, and they have a lot of disorganized or disoriented speech. For example, I asked him a question pertaining group therapy, and he proceeded to talk about Black Friday sales. So sometimes the conversation is disoriented or disorganized.
Thank you, both of you.
I
Excellent.
would like to add to that as well, because I work with a lot of autistic children in my classes. And their stimulation, they stim. They usually have something that stimulates them. Sometimes they stim to touch, like they like to touch certain things. Something soft, it could be something rough. Sometimes they will, I would say obsess, but they can get on something that really like they see a commercial and they can repeat it over and over and over again. Or some of them don't like to be touched. And that's like a sensory issue. And communication, some of them, like she said, is fragmented. You know, there are times when they can speak completely fluently, they can speak fluently, and then sometimes they may speak in phrases, and or they may use a symbol to represent a whole thing, like Walmart, you know, it has the logo. They may call it the Sun Store instead of Walmart because of that little yellow logo. So those are some of the things that you'll see with autism.
Thank
Yeah.
you.
And to add to that, Tessa, most of them, most of these kiddos and even adults end up needing speech and language to help them throughout life.
Yes, yes, correct. And there are, remember, like, there's also the spectrum of how, you know, bad their symptoms are. Thanks, everybody. That was awesome. Hopefully that answered your question, Eugenia. Okay, let's keep it moving, guys. We're at number 9. What is the primary feature of schizoaffective disorder? Remember, we talked about this, guys. A, alternating mood episodes without psychotic symptoms. B, psychotic symptoms present without mood symptoms. C, psychotic symptoms occurring concurrently with mood symptoms. D, brief psychotic episodes following a stressor. This is a lot like how the questions are on the test, you guys, so you have to read it carefully. Yeah. Yep, remember, guys, we said that schizoaffective is the mood mixed with the psychotic. So good job, everybody. The answer is C. Right. 10. Which disorder involves intrusive memories, nightmares, and avoidance behaviors after a traumatic event? A, acute stress disorder. B, post-traumatic stress disorder. C, adjustment disorder. D, generalized anxiety disorder. Yep, good job, you guys. It is definitely B. Good job. Everybody got that one right. Okay, you guys, here's my thing on schizophrenia. Y'all know everybody talks about seeing that on the test, positive and negative symptoms. So which of the following is a positive symptom of schizophrenia? Positive. So we have A, flat affect, B, delusions, C, avolition. I think that's how you say that. D, social withdrawal. Yes, good job, everybody. Looks like it's sunk in because everybody is saying B. So remember, guys, positive is something, again, the way I explain it is how it adds to your reality, adds to your personality. Negative is like it's taking away. So with the flat affect, it's like taking away your emotions and your ability to express your emotions with your facial features. Avolition, lack of motivation, taking away motivation. Social withdrawal, taking away your social connection with others. The only thing that's really adding is the delusions. So good job. All right, number 12. What is the duration criterion for a diagnosis of I can't say that. Can somebody say that, please?
Cyclothymic.
Thank you. A, 6 months, B, 1 year, C, 2 years, D, lifetime.
2.
Looks like everybody's saying C. I think I see somebody that said B. It is 2 years. I don't know any fancy
Oh
way to
yeah, I meant 2 years. I'm sorry. It's 1 year in. Yes, 2 years.
Okay, someone want to speak up and tell me what cyclothymic disorder is?
It's a persistent low mood. That's not like, it's not the same as major depressive. It's just a consistency in low mood is how I remember it.
Yep, low mood or depressive symptoms.
With periods of hypomania.
Yeah. So it's clinically significant distress or impairment in social, occupation, or other areas. So the symptoms are not better explained by other mood disorders, medical conditions, or substance use. We know that's true for most things. Hypomanic and depressive symptoms are present for at least half the time over the 2-year period. So, like summary, I guess, on cyclothymic disorder. Weeks of elevated energy, optimism, and irritability, followed by weeks of feeling sad, fatigued, and unmotivated. However, neither phase is severe enough to be classified as hypomania or major depression. I'm not sure. If I'm wrong, please somebody tell me. Somebody's asking me something in the chat. Oh, somebody's talking to someone else. Never mind. Jocelyn, why is it different for adult and children? Yeah, Jocelyn, can you tell us that? Would you mind explaining that to us?
Actually, I'm not 100% sure, but I know I took it from a Dr. Pam video and it's in my notes. So she did say that it's for children is 1 year and for adults, it would be 2 years.
Okay.
That is correct.
It makes sense, right?
Yes, it is correct. I know for sure.
Yeah, I just thought it's for both persistent depressive disorder and for cyclothymic disorder. It's both 2 years for adults and 1 year for children or adolescents.
Perfect. Thank you for clarifying that, you guys. You learn something new every day, right? 2 years adults, 1 year children. Okay, let's move on. 13, which diagnosis is most important for a child who has difficulty reading, including issues with word decoding and fluency? A, autism spectrum disorder, B, attention deficit hyperactivity disorder, C, specific learning disorder with impairment in reading, or D, language disorder. What do y'all think? This is kind of a critical thinking one because we definitely didn't cover anything close to this.
Only few. It is C because it's a specific learning disorder and impair. I did this last night. I know it's C.
Oh, thank you. Yeah, it is C, you guys. Good job. It definitely, we basically went over autism today and the question doesn't talk about anything that we were talking about earlier. And it does not cover the ADHD. So C would be the only. Language disorder is way too broad, right? So when you're in doubt too, like even I would have been on this question, just eliminate what you don't know. It can make it be, or it can be less overwhelming if you're just down to 2 answers versus being overwhelmed by all 4. Okay, almost done. A client reports a persistent fear of social situations due to fear of embarrassment or scrutiny. Which diagnosis is most appropriate? A, agoraphobia, B, social anxiety disorder, C, specific phobia, D, panic disorder. I think we talked about this earlier, you guys. What do you guys think the key word is in that question?
Social situation.
Perfect. Good job, you guys. If you were reading fast, you wouldn't have saw that. I'm serious. I say that because it's true. You're gonna find yourself doing that on the test. Okay, yes. So we got social anxiety disorder. Okay, last one, you guys. We got to end on a good note. Kind of a dark note talking about narcissists, but here we are. Which of the following is a key feature of narcissistic personality disorder? A, reoccurrent suicidal gestures. B, persistent patterns of grandiosity and lack of empathy. C, excessive attention seeking and dramatic behavior. D, fear of abandonment.
We got it.
We got it, guys. B. Yes. Yes. It is B. Good job, everybody. Does anyone have any questions, comments, concerns about anything that I shared today, or anyone want to provide any insight, or what are we feeling like, guys?
We're pretty good, I think.
Okay. We're having,
Where can I find this quiz in the files tab?
yeah, I'm actually gonna put it in there right now. Always after I do the Zooms, let me stop recording this.